Hopefully you can hear me. It does sound like the sound is pretty good. Okay, wonderful. I'm so happy to be here today, back with PARCA this year. And what an honor and a privilege to talk to you about a group of people that I think have made a huge, huge difference in our state. And that is the Alabama Opioid Overdose and Addiction Council. It's a dedicated group of professionals that really felt a huge sense of urgency. You've heard folks talk about that today. They committed resources, time, and energy, and the partnerships that developed through this group really have served to turn the corner on the opioid crisis. We're not done yet, but we certainly are doing much better than we were several years ago. So as you heard earlier today, in Alabama, we had the distinction of being the state with the highest prescribing rate in 2012. So we were at 143.8 prescriptions per 100,000 or 100 people in the state. So that is huge. Thankfully, in 2024, the prescription rate went to 68.5 prescriptions. So from 143 to 68.5. So from 2016 to 2024, we have seen a 43% decrease in opioid prescriptions in our state, which is huge. That was one of, obviously, the major problems. You heard Dr. Traffenstadt talk about that issue and how that was addressed. And then the real difficult issue, of course, is the overdose rate in our state. And if you remember seeing the Jefferson County slide, this is the Alabama slide. So the overdose rate followed a similar pattern where in 2023, which was our highest rate, we were at 1,603 overdose deaths in our state. Today, as of September 2025, we are at 903. So 700 people fewer than 2023. So that is a huge, huge decrease. And as you can see from that graph, it started going down very rapidly. And I really do believe it is the work of all of the people in this room, in the community, the council, all of the organizations that have really, really focused on this issue and have made such a huge difference over the last couple of years. So how did the council become a council? So in 2017, when Governor Ivey came into office, she established the council, the Alabama Overdose and Addiction Council, through an executive order. And the council was established to develop a comprehensive, coordinated strategy to combat Alabama's opioid crisis. So really, looking at the model that you heard about in Jefferson County and the work that they were doing there, really tried to bring that to a statewide level. So that we had that same level of engagement from all over the state and multiple folks involved in that process. So the council is really made up of 40 agencies and organizations, but the real work goes on in that council in the subcommittees. And we have 185 individuals who work on those subcommittees. And one of the most important things to that subcommittee work is what you've already heard today. That subcommittee work does include individuals with lived experience, family members and others who've experienced an addiction in their family. And so I really believe that, that's the secret sauce to what we're doing in the council. And then you had the other professionals who could bring resources to the table and access to things that are normally maybe not available. So that collaboration that has grown out of those subcommittees is obviously really saving lives today. So how was it structured? The Alabama Overdose and Addiction Council, Governor Ivey named 3 co-chairs, the Alabama Department of Mental Health, the State Health Officer, and the State Attorney General. I don't know if y'all remember this, but at the time, Attorney General Marshall went to the governor and asked if he could be a co-chair. And he did that because he had his own personal experience with a family member who had an opioid use disorder. So when people came to the table and the folks who were involved in this, it wasn't just in their professional role. It was also very personal to many of the members, not just the individuals with lived experience, but also individuals, professionals who had had their own experience with overdose in their family or with loved ones. You know, and really, to me, the whole philosophy of the committee was really about finding good work and joining people in that work. We were really trying hard to figure out where's the innovation, where are good things going on, and let's figure out a way to join people in that work. And if you haven't noticed today, the other special ingredient that I believe is there in this work is a bit of divine intervention. When you heard the panel earlier, there's some things that happen and people were in places that really, other than divine intervention, I don't know how you explain it, because it really was a crisis that needed an all hands on deck and really some innovative, kind of creative and really spiritually led activities that normally we wouldn't even be having those kind of conversations. So there are 6 standing committees that work with the Opioid Council: the Data Committee, the Prescriber Dispenser, Rescue, Treatment and Recovery, Community Engagement, Law Enforcement, Workforce, and Maternal and Child Health. Somebody asked about funding later, so I'm going to talk about funding. Yay! You know, a lot of us have been on committees before and you have a great mission, but kind of the bottom line is if you don't have some resources to bring to the table, it is really hard to get your mission accomplished. So federal funding began to come into the state in a much larger amounts than we had seen before. And so starting in really around 2017, we saw the state opioid response grants, which allowed us to expand medication-assisted treatment and provide other resources and access to treatment for individuals with opioid use disorder. And so really the SOAR grant really accomplished 3 things. Again, expansion of medication-assisted treatment. Really before SOAR, there was no ability for us to expand medication-assisted treatment. So we went from 19 programs and we added 22 additional programs, so 116% increase in medication-assisted treatment programs in our state. So that was huge in people getting access to care. Those funds also helped us with recovery programs and recovery supports. You heard John talk earlier about the army of certified support specialists that are out there now. We were really able to support our recovery organizations in a way that we never had been able to support them before. And so right now we have over 500 of those. It's an army of 500 right now, John, a little more. So we're very pleased with that. That grant also provided something really important, which is the state coordinator, the state opioid coordinator. And the way the grants were written, it was really designed to have this person coordinate everything that was happening in relation to opioid overdose and addiction. And so that became a very important part. That is the person who staffs our opioid council, and she's actually here today, Debbie Metzger, who does a fantastic job. Thank you, Debbie. And I would, just for fun, if you've been a member of a subcommittee or if you've served on the council, would you please stand? There's quite a few of you in the room today, I think. Yes, all right. Thank you, guys. The SOAR grant was also the first time that we were able to fund naloxone statewide. And so the SOAR funds were really instrumental in us really being to ramp up access to care and access to naloxone. You heard a little bit about the OD2A grant. So this is just a little bit about that funding. That grant actually came to the Department of Public Health, and we were a subrecipient of that grant. And you heard from Dr. Traffenstadt a little bit about the focus on data and making sure that we were doing prevention programs and other things that were based on informed data. The other thing that the OD2A grant funded was the Connect app, which is a treatment resource for individuals who are looking for treatment. How many of you have the Connect app downloaded? Yay! All right, cool. If you don't, just go to your app. App Store. Yeah, I'm 64, so there you go. Go to your app store and download the Connect app. We also use some of those funds to connect to care for individuals leaving jails to ensure that they had continued services as they transition to the community. From the general fund side, you heard Representative Treadaway talk about the pie and everybody wanting a piece of the pie. But in 2023, Governor Ivey funded the first increase in substance use treatment beds since the 1970s. Yeah. So 4 new 16-bed treatment facilities opened in DeKalb, Lee, Madison, and Walker counties. Most of them really opened in 24 and 25, but so far they've already served over 401 individuals. And then you also heard mentioned the opioid settlement funds. So in May of 2023, the state received the first round of opioid settlement funds, and legislation was passed and established the Oversight Commission on Alabama Opioid Settlement Funds. But here's the reality of what that group did. They basically took the plan that the council had developed and looked at that plan, and the Legislative Services Agency, who was charged with figuring out what the Opioid Commission was going to spend the money on, really took that plan and used that plan as the basis for how funds are allocated through the Oversight Commission. We worked really hard to make sure that money got spent on prevention, treatment, and recovery and on opioid-related items. For those of you who've been around long enough, you'll remember the tobacco settlement, and that really didn't get spent on anything related to tobacco. So honestly, we were a little concerned that the money would wind up going to things that were not related to opioid use disorder or treating opioid use disorder. We have done 3 rounds of funding through the opioid settlement funds for treatment, prevention, and recovery. And you should know also that A.G. Marshall made the decision not to join the national lawsuits that were going on. His position was that Alabama had been disproportionately impacted by the opioid settlement dollars, and all of the national settlements were really based on a formula on your population. And so he was really adamant that Alabama deserved to have much more funding because we had much more of the problem. And a lot of what you see right now with the settlements is the hard work the AG's office did to make sure that Alabama was well represented in that. So this just gives you a little bit of an idea of opioid settlement grants from round 1 through 3, which is the money that we administer through an RFP process. You can see that over the rounds, we've seen an increase in the number of organizations that have applied for those funds. In the last round, we hit 88, and we're really, really excited about that. For us, we also had a lot of organizations that are what we would call non-traditional providers, so not currently certified for our department for prevention, treatment, and recovery. And honestly, that was one of our goals, to increase the number of community-based and nonprofit organizations that are receiving the funds and then also are certified by our department, which then puts them in a position to potentially receive other funds from the department. So out of the 209 proposals, 64 were from organizations that we had never previously certified before. Organizations like Boys and Girls Clubs, churches, faith-based organizations, that we really believe are in the trenches working with kids and families who need to know about opioid use. So what was the function of the committee? The council recognized substance use disorder as a complex, multifactorial health condition that can be prevented and treated. And then the subcommittee, their purpose was to develop a plan and implement dynamic solutions to meet the needs of Alabamians with substance use disorder. And they really had 4 overarching goals: prevention, intervention, treatment, and community resources. Or community response. Okay, now we're going to have some fun. Okay. This did this last year, let me just say that. So to give you a little bit of an idea of some of the major accomplishments of the subcommittees, you heard a little bit about the data and surveillance efforts in the state. That was really the focus of the data subcommittee. And so they were able to establish a governance board and began to develop data sharing agreements between state agencies. Let me tell you something, that is no small task. I've been in state government 34 years now, and the number of times people have attempted to do data sharing and failed is a big number, really big number. And so for this group to be able to accomplish this, and again, because people felt a sense of urgency and a real need to address the overdose deaths. And so arguments that you used to have around the table just didn't happen. People were ready to come to the table and do what they needed to do. The central data repository was made available to the public in 2022, and we've had more than 16,000 visits to that site. Okay. Prescriber and Dispenser Subcommittee, you heard a little bit about that group, but one of the really successful efforts of that group is AlaHope. It's the Alabama Health Professionals Opioid and Pain Management Education. So this was launched in May of 2023, and it provided free continuing education credits for physicians as well as other clinicians. And so far, there have been 3,370 course completions as of October 1st, 2025. So we have physicians and other clinicians going online to learn about opioid use disorder. The other conversation you heard a little earlier is about the prescription drug monitoring system and really trying to track how many opioids were being prescribed to an individual. And so a lot of work was done to really be able to have access for physicians to be able to know if an individual was receiving prescriptions from multiple physicians. And so you can see that the use of the prescription drug monitoring system has dramatically increased, so a 61% increase in the use of that system from 21 to 2025. So that tells you that, you know, the education out there about that is really working. We talked a lot about Narcan distribution. So over 192,000 kits have been distributed by our partners. So thankful for the legislation and thankful for the partnerships and our folks at Vital who've done a fabulous job. Jefferson County Department of Public Health did the heavy lifting on getting this out, and couldn't be happier about the number. And yes, I have in my glove compartment and in my car, and my grandkids have Narcan, and they look at me weird, but I'm like, trust me, you might need it. You never know. And treatment and recovery, the Connect app is really something that we're very excited about. It launched in July of 2022, and we've had over 23,000 downloads of the Connect app, and then over 10,000 resources through the Connect app. Community engagement and outreach is another area where we've done a couple of campaigns, but really exciting is the One Boxes distribution in 2025, which is an emergency opioid overdose reversal kit that we're distributing, and very excited about that as well. Law enforcement, never thought we would be able to get fentanyl test strips legalized in Alabama. It's previously considered drug paraphernalia, but in 2022 that happened. And since then, over 104,000 strips have been distributed. And then we also have for the first time in Alabama through opioid settlement funds, the Department of Corrections provides medication-assisted treatment to people who are coming out of prison. Never thought I'd see the day that we would see medication-assisted treatment in prisons. That tells you how far we've come with stigma. So yeah. And as you heard a little bit today, there's a lot of treatment going on in our correctional settings, both in Department of Corrections as well as the Bureau of Pardons and Parole. Maternal and child health, we are supporting the screening, brief intervention, and referral to treatment training for obstetrics and maternity providers through Vital's Alabama Every Step program, and we're very excited about that. Also partnered with law enforcement to outreach to county courts, district attorneys, and law enforcement about local treatment and diversion options for pregnant and nursing women with substance use disorder. And our workforce subcommittee developed a toolkit, and there have been 347 downloads since January of 2025. And so as you can see, the committees are pretty busy. These are some stats on our opioid settlement grants. You can see more about that on our website with more detail. And then I did want to talk about our Take Notice awareness campaign. And this is really designed to equip and empower Alabamians to end the opioid crisis in our state. And this is a partnership with ADMH and the Alabama legislature and our friends from Telegraph who are here today. You guys stand up because I'm fixing to show your video. Yeah. So this is just a brief video.
My first experience with opioids, I was sitting in a hospital room, and I just remember feeling, this feels so good, and I want to feel this way every day.
They were prescribed by a doctor. It's no big deal. Just mom's little helper.
The pills we felt were probably the least harmful because something that came from a doctor, it can't be that bad.
3 and 4 pills would turn into 9 and 10 pills. I couldn't go on without them. I had to have them.
Once I started doing heroin and I couldn't stop, that's when I realized what my life had become.
Old values and morals were completely cast away.
I'm taking people's cars at gunpoint.
Why can't you just be a good mom?
Couldn't hold down a job.
And I was tired. I had been running for so long.
Addiction is lying to you because there's joy and fulfillment beyond your wildest dreams.
I'm grateful for my recovery, and everything else falls underneath that.
Taking classes, I'm facilitating groups, giving me a sense of purpose.
There is a way out that's so much bigger and beautiful and better than you even can imagine.
Great. So to summarize the impact, We've seen a real decrease in overdose deaths. We've seen tremendous expansion of treatment and recovery capacity, increased access to life-saving naloxone, professional training for health and law enforcement providers, a reduction in prescribing and potency of prescriptions, and major policy and legal changes to reduce harm. And that is the work of the Alabama Council, and just honored that I get to share their story with you today, so thank you.